My name is Dillon Morris, minimally invasive and advanced GI surgeon specializing in abdominal wall reconstruction and hernia repair at CPG Surgical Specialists here at Community. I am residency trained in general surgery, so I see the full panoply of general surgical complaints. Essentially, I tell folks I see anything in the abdomen that is not the kidneys or gynecologic organs. I did pursue additional fellowship training in minimally invasive and advanced GI surgery, so I have additional expertise in minimally invasive techniques such as laparoscopy and robotic surgery, and my particular area of clinical interest is abdominal wall reconstruction and hernia repair. My feeling is the most important thing when a new patient comes to see me in the office that they feel comfortable with what's going on. It is really scary to go see a doctor, particularly a surgeon. So first and foremost, I think it is really critical to establish that trust with my patients. And I think that trust comes in a number of different ways. Knowledge of my specialty, I think, is really critical. You want to go see somebody who knows what they are doing and understands all of the most advanced, newest techniques that they can apply to maximize your chance of success. So I try and instill confidence in my patients by demonstrating confidence in my skill set. Additionally, too, I think that it's very important to be warm and understanding of what patients are going through when they come to see you. We have no concept of what people are going through in their daily lives, but generally if people are coming to see a surgeon, it's because they have a problem going on. They want it to get fixed. So I want them to feel comfortable that in my hands, that problem is going to get fixed and it's going to get fixed effectively. One of the things that I find most rewarding is when a patient comes back to see me after surgery and their problem is fixed and they're feeling good. As a general surgeon, I get to deal with a broad array of different medical issues. So I get to have an impact on a bunch of different areas in a patient's life. Specific to hernia repair, hernias can have massive impacts on patients' ability to do the things that they love, maintain good quality of life, go out in public without feeling awkward about a big bulge in their abdomen. So to be able to fix those problems for patients, to allow them the opportunity to take back control of their life and do the things that they want to do that they may otherwise not be able to with that problem is massively invaluable. Outside of work, I have a number of things I enjoy doing. I have two small dogs, Chewy and Cosmo, that I like taking to the dog park and on walks frequently. I'm an avid comic book collector, so always trying to hit up the comic shops on New Comic Wednesday every week. And then finally, as a kid, I was a huge fan of video games, and as a robotic surgeon, I essentially get to play video games at work. So I just get to carry on all of the great hobbies that I had as a child.